As the weather warms up and people want to get outside, Toronto Public Health reminding us to take care when it comes to ticks and Lyme disease as we head out into wooded or bushy areas here in the city. Associate Medical Officer of Health, Dr. Christine Navarro, joins us this morning with some tips as we head into the long weekend. Doctor, thank you very much for joining us this morning.
Thank you for having me.
It's not always something we think about as being in the city, ticks, but they are prevalent here. And there are concerns about it, are there not?
Yeah, that's true. Over the last, say, 5 or 6 years, we've seen an increasing number of ticks, especially in the eastern side of the city, say areas around Rouge Valley that are wooded and bushy.
And why is that? Are they, I mean, we've seen a growth of wildlife coming back into the city. Is that the reason for it?
Yeah, that's definitely a factor. They do like areas that are populated by rodents and deer. Also, we have a lot of use of that area of Rouge Valley, and so that's where we have the interaction between the environment and the animals and the people coming in to the areas where the ticks might be established.
And if you're out, where are some areas maybe that are best to avoid, and what should you be wearing if you're going to go out for a walk? Because I know we want people out and exercising. We don't want to stop people from going out, but just something to be aware of. What areas, though, maybe are the good ones to avoid?
Well, we do want people to enjoy the amenities that we have available in the city, like Rouge Valley. You should stick to the marked trails. If you do go out, make sure that you're wearing a DEET or a cardigan, which are effective insect repellents. You can wear long sleeve shirts, pants. When you come back in from outdoors, you can make sure that you change, put the clothes in the dryer, do a tick check, and take a shower, and that will prevent any ticks that you may have brought with you. It'll keep them from attaching to you.
And what are you looking for when you're looking for ticks? They're not easy to find. What are you looking for? Are there signs, or do you just actually have to look for the actual creature itself?
You're looking for the actual tick. So it can be as small as the period at the end of a sentence, or if it's been on there for a while and it's been feeding, it might be the size of a pea. And they do like to crawl into the nooks and crannies, so make sure that you look groin, armpit, hairline, and all of those spots, not just on yourself, also on your children, on your pets. Have a good look and make sure that you, if you see one, you remove it with pair of fine tip tweezers. Just put it as close to the skin as possible and pull away firmly and gently.
And it's important because you have to make sure you get all of the tick, right?
Yeah, that's right. So just put the tweezers as close to the skin as possible. You don't want to use anything else. Don't squeeze it. Don't burn it. You could use your fingers if tweezers are not available to you.
And with Lyme disease, it's only the black-legged ticks that carry it. And what is the concern? And if you see that a tick has bitten you, what should you do?
So with Lyme disease, it can be mild. It can be like a flu-like illness. But for some people, they can have, if it is untreated, they can have long-term consequences like problems with their heart, problems with their joints. So if you do see that you've been bitten by a tick, as I mentioned, you remove it. If you do feel that it's been on there for a long period of time, like say several hours, 24 hours, 72 hours, you should certainly see a doctor, and you may be able to get antibiotic prophylaxis to prevent from getting sick from Lyme disease. And also, if you have any symptoms and you've spent time in this area, whether or not you recall necessarily getting a tick bite, see your doctor.
Okay, and quickly before we go, the tick surveillance program, if you can just give us a quick little lowdown on that.
Yeah, so usually we do what's called active tick dragging. So we have staff who go out wearing Tyvek suits. They go out with a piece of flannel. They drag areas where ticks are likely to be found over a period of time. And there's a nice image there of what it might look like on a flannel sheet. We enumerate those, and we get those tested to see how the level of positivity among the ticks that we find. We usually do that in the spring and the fall. This year we'll be doing it just in the fall because of all of our activities related to the COVID response.
Okay, and you can get more information with Toronto Public Health. Dr. Navarro, thank you very much for joining us this morning. We appreciate it.
Thank you.